And when I share, I'll turn off my video.
That's fine.
I have pretty good internet, but it is one of those where
why take the chance?
Yeah, lags it out.
And I know there's some people that weren't able to join, so I'm going to send them the recording anyway. So I've already got a list going for that.
And for those that have joined, and you, Sharon, I apologize in advance if you hear a dog bark. She's pretty quiet normally, but like I told you, Sharon, there's folks doing yard work, so every once in a while she'll catch a glimpse and go nuts. She's all of maybe 10 pounds, but thinks she's a guard dog. So she will bark.
Sounds
not
like
a
my
lot.
dog.
She's usually a pretty good listener, but just in case. I typically will try to mute if she goes nuts, but
all right, I'll give it another minute. Thank you for those that have joined us so far. We're going to start shortly, so I'm going to give folks another minute or so to join, and then we'll get started. So just one more minute, folks, and we'll go ahead. Okay, hello everyone. Thanks for joining us today for our webinar with Zing and Ryan Combs. And if you have not met me before, my name is Sharon Fourcha with IED here. I'm the broker manager. And just some housekeeping items before we get started. And I'll introduce Ryan in just a moment. If you are interested in contracting with Zing, I'll be following up with everyone via phone and email following this webinar within the next couple of days. And I know it's a holiday weekend, so I may follow up if I can't get a hold of you, I'll follow up with you next week. Otherwise, you can also get a hold of me here at the office and just ask for Sharon. And those that have any questions, please enter them in the Q&A and I'll monitor them as we go. And time permitting, we'll answer those at the end. If not, I'll send those over to Ryan and get back in touch with you via email. So here we go. Today, I would like to welcome Ryan Combs with Zing, and we're going to talk primarily about the C-SNP plans, and he'll have some other details on the other plans they offer as well. Thank you for joining us, Ryan.
Thank you, Sharon. I appreciate you give me the opportunity to share the C-SNP and the opportunity, that is presented within the C-SNP, with year-round SEP. I'm gonna go ahead and share my screen real quick. Thank you, everybody, for joining. I know taking time out of your day is important, so hopefully I bring you extreme value. Like Sharon said, please use the Q&A. Happy to answer any questions. Sharon's going to keep an eye on that, and I can answer those. I've got time. After this, I kind of book in some extra time, so if we go a little over, I'm happy to stick around. But please, drop any questions into the Q&A so we can address those and make you feel like you kind of took away something and made this time valuable for you. So like Sharon said, I'm Ryan. I'm the regional broker manager for Zing Health. Today we are going to do kind of what we call our C-SNP Academy. I do sneak in a couple things around our other plans, your general enrollment type plans, as well as our dual special needs plans. But the primary focus will be on our C-SNP because it does have that year round. It is where we have invested heavily in everything that we are doing. There we go. So kind of rattling off the agenda for today, we'll kind of talk about our market overview, how somebody is eligible or ineligible for C-SNP, our provider verification process, the benefit highlights, and then time permitting, I can do or won't do some of the prospecting and marketing, materials. I'll talk about certain things. What I try to do is kind of tie it into how to present this within the C-SNP space. Most of you and I'm happy to spend extra time. I know IAD spends a lot of, gives you guys a lot of resources in marketing yourself. I'm happy as well to carve out time for you to talk about how you could market, Zing, the opportunities that we have available, and everything of that nature. A little bit about our team. So we're led by Chris Murray. He is our VP of Partner Sales. And then we've got our regional broker team, which consists of Jason Harrington. He kind of supports all markets that we have. You got Alex Gutierrez for anybody doing business in Illinois, and then you've got Sarah Newman in Indiana, and then myself. I gotta fix my picture. Somehow me and Alex are condensed down, look goofy, but I'm the regional broker manager for Michigan here. We offer two types of Medicare plans. So we have the standard Medicare Advantage products, or your 𝗍𝗵𝗶𝗀, as well as a provider-specific plan. That's, a narrow network plan. And then we have our kind of what we consider our core products. We're really trying to go into market with differentiated products, really designed around targeting those underserved and urban populations, as well as those with the chronic special needs. So our big focus is that chronic special needs plan, but we also have the dual special needs plan for those that have, full dual eligibility. So looking at, the market of C-SNP, you can see here, 26% of the MA population has diabetes, 13% have chronic heart failure, and then COPD, which is, another condition, oftentimes, coexists with something else. Most people have more than one chronic condition. They're dealing with these comorbidities that ultimately are keeping them constantly seeking care, but never really getting, things done and coordinated. And that's kind of where C-SNPs are looking to have the advantage in this space. But you can see there, out of those 15 million people that have just those three conditions, only 400,000 are enrolled in a C-SNP nationwide. So huge opportunity. This is a hugely under-penetrated market within the Medicare eligibles, and they're underserved, and a huge opportunity, but also it comes with the year-round SEP. So it's something that you can tap into now. It's not something you have to wait for, AEP, OEP to make moves. You can enroll these folks year-round. Some of the advantages. So for members, these are, differentiated products that ultimately are tailored to their needs. So if they have, chronic heart failure, they're going to have lower copays to see their cardiologist. They're going to have, tier 6 in our C-SNP plans that allow them to get certain name brand drugs at a $0 copay, and things like that. Ultimately, our goal for them, the advantage that we're trying to, have with them is lowering their rate of hospitalization. We want to keep them at home, healthy and happier longer, and we want to decrease their likelihood of mortality. We want to keep them alive. That's our goal: manage their care, keep them healthy. For the providers, it takes a lot of the headache away. When members don't have the correct benefits, don't have, the appropriate cost share or really a plan design. And I know MA is very competitive. So for the last few years, a lot of benefits have been, really rich to where people have had far better access than they have in the past. But, C-SNP is going to continue to provide that as we go into 2025. And it ultimately allows the provider to not have to worry about whether or not the member is going to be able to afford a certain, medication, whether or not they're going to be able to afford, follow-up care and things of that nature. Because, we all know all of society is on, fixed income. You make what you make. For the senior population, that's a much lower number most oftentimes. So it kind of takes that headache away and allows the provider to focus just on the clinical needs and address those. And then some of the benefits through the value-based care organizations that we have and things like that can help drive better clinical outcomes as well. For you, the broker, it continues to be that year-round sales opportunity. And what's really great is we see this as, has stickier business than the dual special needs plans have been historically. Folks are enrolling in these plans and looking to stay with these plans. They're not looking to capitalize on certain benefits and then move on to the next. They're really, and because it's an underserved niche and also an underpenetrated niche, it doesn't have the focus that the duals market has. So you're seeing all eyes kind of turn to the C-SNP, but it's not like that where if anybody is familiar with the duals, there's people calling them regularly, trying to make that move. So it's a highly targeted population, whereas the C-SNP is not. And then for you, it is also that differentiated product that isn't a familiarity to the population you're looking to target. So you get to introduce them to a product suite that is rich in benefits for the benefits that they actually need and will be able to utilize to create better health outcomes. Like I said, this is a year-round sales special election period. So it allows you to continue to grow outside of AEP, OEP, and any Medicare individual who qualifies via chronic condition, but is not currently enrolled in one. So if I have heart disease and I don't currently have a C-SNP, I can enroll in a C-SNP year-round. Any month, it's just going to be effective the first of the following month. And while this is an underserved niche and underpenetrated, we did see 42% year-over-year growth in the C-SNP space. So, like I said, eyes are starting to shift towards this. If you watch kind of the trends in our space, and 2025 is going to throw a wrench in all of it as everybody tries to adapt to some of the new CMS, requirements and guidelines. But historically, D-SNP has kind of held that percentage, and this is the first year it was relatively flat in growth, but C-SNP saw that 42% year-over-year growth. So it's one that's going to get all eyeballs. It's one that's doing very well in terms of retention. So you build that book of business, have that longevity of that book of business. As you can see, we'll stay focused on Michigan here. Non-C-SNP plans available here in Michigan is about 210. Total C-SNPs are 6. So we do have a little bit of competition here in Michigan. But we have 3 C-SNP plans. We have an HMO and a PPO focused on heart and diabetes, and then we have an HMO plan focused on end-stage renal disease. It's kind of our strategy to win in the C-SNP market. So it's kind of 3 big areas that we're really focused on. So you have our product design and the benefits. So really, taking that and focusing on where we hear the challenges from those specialists and those providers in that space. So like when you look at ESRD, one of the biggest challenges was the cost of dialysis for those members, or transportation. When you look at heart disease, they can't get the drugs filled. The name brand drugs aren't covered in their plans, things like that. Diabetics, insulins, even with the savings program that caps it at 35, that's still a challenge for a lot of folks when they have all these other drugs. So we've been able to design products that lower those co-pays, co-insurances for seeing a specialist, provide transportation, lowering drug costs, whether it be, putting in a tier 1 or tier 2, creating a tier 6 in the C-SNP space. We have $0 insulins. The insulins covered in our formulary are $0, and that's through the coverage gap. And then we have $0 medical supplies, therapeutic shoes and inserts, as well as a free continuous glucose monitor. Our care management team, everything we do is focused on the member. Member engagement is critical in not only the MA space, but by and large, the C-SNP space. We are a managed care organization, but on top of that, we're trying to manage the care of those that have very specific needs. So everything we do is really, focused on that member being at the center of everything, that happens. So we have adopted Salesforce to ultimately drive, that member engagement and member experience, so you can see there our net promoter score of 67 versus an industry average of 29. So we're doing a lot of things right when it comes to that member experience, driving better outcomes and doing right by the members as it happens. continuous room for improvement there. But the one that, as we, our products can set us apart, the experience is going to be great. But one of the big things that's going to help for you as the agent, not that the other stuff doesn't help, is the verification process. So we have a proprietary technology platform that reduces the fallout through what we call automated verification. So when our system, basically, when you submit that enrollment, it's taking a look at, the data sets that has access to, and ultimately can provide approval based on what their history is through claims and prescriptions and things like that, will ultimately green light that to effectuate. So this is going to lead to that higher effectuation rate, keeping those members on the books for that 90-day window so you don't get hit with that rapid disenrollment, and then ultimately reducing the amount of chasing that you have to do of your members to collect any provider verification. So we'll talk a little bit more about that provider verification, but it is something that in the CSNP space, it has been the biggest headache from the agent community is, you sign somebody up, now you got to go chase that provider verification. Providers don't always fill it out in a timely fashion, but you do have a limited window. But yeah, so we'll kind of get into some of the product design, but ultimately, we're looking to reduce the cost across the board, whether it be medical, pharmacy benefits, introducing some strong supplemental benefits, like healthy food and utility cards, flex cards for dental, vision, hearing, as well as like, nutrition therapy and other things to support their chronic conditions. Like I said, our member engagement is centralized, so everything is focused on that member experience, and our member engagement team is driving the positive outcomes by coordinating between all the different groups. So even with some of our supplemental benefits, rather than just kicking you over to the vendor that we use, our team is actually going to be much more hands-on, take the information, run with it, get to the resolve, get the answers, and provide those back to the member so we can control that experience much better. So as you can see, our Net Promoter Score 67, which is industry leading and allows us ultimately to, lead to a better experience. We're also hosting member orientation. So if you do write Zing and your member's like, hey, I got invited to this, that's just me and my team from headquarters. We're putting those on to help make sure they're plugged into the right benefits. They know where to go, who to go to, and ultimately, helping them and engaging them to ultimately create that better outcome. So, but if you ever get, if you're writing business and your member gets something, please feel free to reach out. You'll see my contact information again at the end. If you have questions, concerns, as you're writing, want to get writing, please reach out. I'm always a phone call away or a text message away to help you. I'm here to help you grow your business. So don't want to stand in the way of that. But kind of looking a little deeper at that automation. So what happens is you submit that enrollment. When you select a CSNP plan, it has a quick needs assessment that asks a handful of additional questions. Once that's submitted, that enrollment goes into our technology platform, and all the AI, the machine learning that happens, and again, this is above my level of expertise. All I know is it's working pretty well, and it's something that has reduced the amount of chasing that you have to do, and it's something that we're kind of the first and only in the industry to really have this really built out process. But once that hits our technology platform, it's looking at those data sets, utilizing that information to verify that chronic condition. If the platform is unable to provide the verification, our medical director reviews the same data sets and looks to verify the condition. If they're not able to, and the technology is unsuccessful, that's when we will begin to conduct provider or member outreach for that verification. Typically, when we see that, maybe it's a new diagnosis, maybe it's not a clear diagnosis, or whatever it may be, to where it just can't be verified. So then we send a form to the provider. We engage the member to help that, And then we take it a step further, and we're actually outreaching to you to let you know that this is ongoing, so you can then step in. But again, this is, we're currently, our auto verifications are about 93%. That means out of all the enrollments, only about 7% are requiring additional outreach and coordination. So not only does this lead to higher effectuation, but it's going to help you, because we know, the finger gets pointed at the agent more often than it should in a lot of cases. So when things like this happen, we want you to be one of the first to be aware. If it doesn't verify, and then we send that to the provider and the member and include you, and it still doesn't verify, at day 30, they'll get a letter letting them know, hey, if it's not verified by this date, you will be involuntarily disenrolled. And then at day 60, which is when they will be involuntary disenrolled, they'll get a letter letting them know this is the date of your involuntary disenrollment. And then they have an SCP for the 2 following months after that. We're trying to stay way far out in front of that, to where it doesn't even get to that. But there are some cases where, they tell you, they tell you everything that checks out, like, and you enroll in a CSNP, and they don't. I've had it. I've seen it, not a ton, but I have seen it where somebody has high blood pressure, but they'll lead you to believe that, that's for, chronic heart failure. And it's like, no, you just have high blood pressure. They have no indication they have that chronic condition. Eligibility for a CSNP is you have to be entitled to Medicare Part A and enrolled in Medicare Part B. You have to live within the service area. So those are the standard MA requirements. The additional one for CSNP is you have to have the diagnosis and verification of a qualifying condition. For our plan, Zing Health, those conditions are listed here. So you have cardiovascular disease, which includes peripheral vascular disease, cardiorrhythmias, coronary artery disease, chronic venous thromboembolic disorder, chronic heart failure, diabetes, both type 1 and type 2, and they do not have to be insulin dependent. So that's good. And then end-stage renal disease. And for those that aren't familiar with end-stage renal disease, so as part of the, traditionally ESRD was not, did not allow them to enroll in MA, but as part of the 21st Century Cares Act, this allowed folks diagnosed with ESRD to ultimately enroll into an MA plan. We work with some value-based providers like Strive Health, that connects us to the nephrology practices here in Michigan. So our big 2 nephrology practices are Michigan Kidney Consultants, as well as St. Clair Nephrology. Our ESRD plan boasts, the unlimited transportation to medical services, $0 specialist visit for their chronic specialists, so endocrinologists, nephrologists, podiatrists, cardiologists, pulmonologists, and then $0 copay for dialysis. So driving down a lot of the costs for that population. MA is a lot newer to those folks. Our diabetes and heart plan is currently offered in the counties listed there. So you can see in Michigan, we're in Wayne, Oakland, and Genesee currently. These just kind of look at the enrollment periods and kind of defines when the SEP. I think all of us here, so I won't spend too much time on this. This one is nice. I always like to share this one, and ultimately, you don't always see these all stacked this way, but it can happen sometimes where, somebody's in their ICEP that's also annual enrollment period. It's also, they also have a special enrollment period. So this just kind of shows the stack ranking of if they have multiple, this is the one you would use, kind of a hierarchy. So again, it doesn't happen. It doesn't always align that way. More often than not, it's going to be 1 and 2 or 5 and 2, but it can happen, and this just kind of gives you an idea which one to select when you're submitting the enrollment. We kind of already talked about provider verification. So anything that we do though, so like if we outreach to the member, I want to emphasize this, is if we outreach to the member and determine that they're ultimately not going to be verified, they will ask them if they'd like to move into another plan with Zing, and you will maintain agent of record of that. If you're attached to the member, you will remain agent of record in any change. But we will also outreach to you to avoid any disruption with loss of coverage. So if they opt, hey, I don't really, I wanted the 𝗚CNP, not going to qualify for the 𝗚CNP. The standard MA doesn't really appeal to me. I would prefer to go somewhere else. You're gonna be the one that we send them to. So we'll coordinate getting them reconnected to you. So we're going to work to keep, not only keep them with Zing, but if they choose not to stay with Zing, we're going to make sure they're in your queue to follow up with. So here's a sample of the 30-day loss notice, just kind of standard CMS form. So all of that would be completed, letting them know, hey, if this isn't verified on this date, you will ultimately be involuntarily disenrolled. And then here's the 60-day letter, kind of snapshot of, hey, this is what happens. You have the SEP. It'll give them the expiration date of that SEP as well. And then obviously, like I said, we're going to be plugging you in so you can help process this whole process take place. So looking at the benefit highlights, here's our general enrollment plan. So we have the Elite Select is our PSP plan. So that's a provider-specific plan that works as a narrow network. And that works with our value-based care provider. The big one here is Oak Street Health currently. So you can see very competitive max out of pocket, $0 primary copay, $25 specialist copay. They're getting a dental allowance of $2,500. So that is an allowance that allows them not only preventative, but also comprehensive benefits throughout the year. So that's $2,500 that they get, so if they're getting services that are going to cost $2,000, it's going to cover that $2,000, and so on and so forth. Vision, $0 routine eye exam, $300 for contacted lenses and frames. Hearing, all of our plans you'll see is the same, $750 per year towards hearing aids every 3 years. So $1,500 in total spend for hearing needs. They are going to get a flex card of $500 per year in the Elite Select. That's going to be for dental, vision, and hearing services. There's no carve out specific to dental, vision, hearing. So they will be, they can utilize that for all dental, all vision, or all hearing. Non-emergency transportation. So that's, 48 one-way trips to a healthcare provider. They're going to get $168 per quarter in OTC. Healthy food and utilities. So our general enrollment plans, typically healthy food and utilities is reserved for those with SSBCIs or LIS. So if they have low income subsidy where they're getting the extra help, they're going to get $55 per month in healthy food and utility assistance. Our Select Care and our Open Choice, that's our HMO and PPO. You can see very competitive max out of pockets there. Our PPO has cost share parity as well. So what that means is same co-insurance copay, whether in or out of network. $2,500 dental allowance in the HMO, $2,000 in the PPO. Vision has $350 for contacted lenses and frames. The PPO is $200. Flex card, $300 in the HMO, $1,100 per year for dental, vision, and hearing in the PPO. 48 one-way trips in the HMO, 36 in the PPO. OTC is $130 per quarter in the HMO, $174 in the PPO. And also, if these folks have LIS, they would get $55 in the HMO for healthy food and utilities, or $50 in the PPO. Again, they do have to have low income subsidy. For our DSNP, a lot of those top numbers aren't relevant if they are full dual. They are required to have full dual eligibility to be in the DSNP. Dental is $1,500 combined preventative and comprehensive allowance, $250 for contacted lenses and frames. Hearing, like I said, all of our plans are $750 per year towards hearing aids every 3 years. Flex card, there is no flex card in our DSNP. 48 one-way trips in non-emergency transportation. OTC is $198 per quarter. If they have LIS as well, they get a healthy food and utility card. In the HMO, it's going to be $205 per month. In the PPO, $200 per month. 𝐴𝑐E, you can see our HMO is available in all 3 counties, Genesee, Oakland, and Wayne. Our PPO is only available in Wayne County. Strong max out of pockets at $4,500 and $4,950 respectively. Labs and x-rays are a $0 copay. Our formulary insulin's at a $0 copay, and I have a list of those you can look at. 48 one-way trips in both plans, $2,500 in dental benefits in the HMO, $2,000 in the PPO, vision $350 in the HMO, $300 in the PPO, flex card $750 in each. The OTC Healthy Food and Utility is a combined allowance, and that's a monthly allowance of $116 in the HMO and $73 in the PPO. 𝗵𝗂 is the in-home support, so that can be like companion, that can be assistance with some activities of daily living, additional transportation. They're going to get 60 credits per year, which basically amounts to 60 hours per year that they can use within those services. With our ESRD, this is the strongest, you can kind of see, $0 copays for dialysis, which is huge. So the average person goes to dialysis 2 to 3 times per week, and the Medicare allowable amount is $100. And most plans have 20% coinsurance, so that means they're paying $20 per visit. So you're saving them $40 to $60 per week. Also, unlimited transportation in this, $0 cost on diabetic therapeutic shoes and inserts, dental benefits of $3,000 per year, vision of $300 per year for contact lenses and frames. Hearing benefits is the $750 per year, flex card of $500, and they're going to get a combined OTC Healthy Food and Utility of $157 per month, and then they're going to have 60 credits for 𝗵𝗂 as well per year. Some additional benefits, so telehealth visits with a PCP through MD Live, $0. Lab work and x-rays are $0. Preferred diabetic test strips are $0. We offer worldwide emergency and urgent care services. $0 copay for all Tier 1 generics. Tier 1 includes the insulins in our formulary, so those are all $0 through the coverage cap. We have a Tier 6 formulary. You're going to get a continuous glucose monitor at $0. And then we do cover sildenafil at Tier 2. So here's a snapshot of the insulins within our formulary. So you'll see like Tresiba, Novolog, Humulin, Lantus, 𝗀𝗏, and some of the more prominent ones that you see in the market. And then, like I said, we have a Tier 6 that has that $0 copay during the initial coverage phase. So you can see those listed here. So you've got, like, for heart, you've got Eliquis, you've got Jardiance, Ozempic, Trulicity, Xarelto, and things like that. These are, again, $0 through that initial coverage phase. $0 continuous glucose monitor, so they have that device. It can connect to their smart device or to a receiver. It's going to take those levels every 5 minutes and provide them with a trend on their glucose levels. Some additional benefits that we have our care management that is going to provide assistance with managing their chronic illness and plugging them into additional resources that might be available. Think like nutrition therapy, things like that they're going to be able to plug them into and make sure that they're looking after the whole person. Post-discharge meals, as well as a chronic meal benefit. So like most plans, we have a benefit that gives, if you're discharged from the hospital, they're going to provide a set number of meals. It varies by plan, but you're going to get a set number of meals provided to you after a discharge from inpatient care. And then we also have a chronic meal benefit that's going to provide 28 meals to somebody whose doctor is ordering a change in their diet. So when they're trying to change their behaviors, we're going to provide that benefit to help them make that change. Therapeutic shoes and inserts, routine podiatry services, $0 copay for 6 visits per year. Personal emergency response, no cost for that. That's powered by ADT. And then for those that have chronic low back pain as well, they're going to get a $0 copay per visit for up to 12 visits for acupuncture within a 90-day window. Looking at the marketing, one of the things I want to point out is these resources, and I can share this. These are different organizations that kind of deal with the populations. It's a great way to get involved with organizations that are ultimately going to help you meet people that will be in this chronic, this chronic special needs space. The other is, provider. Looking at the provider network within the market that you are looking to target is a great way to build those provider relationships, to develop ultimately a referral program with them. They're incentivized because they're going to get paid, for these members, but they also want these members to have good quality benefits. So they can introduce you as an independent broker who can ultimately do that needs assessment. If the C-SNP plan, whether with us or a competitor or another plan, works for them, the provider is going to be happy with that. So provider engagement is a big one when it comes to marketing the C-SNP, getting to know those cardiologists, those endocrinologists, the nephrologists, the DaVitas and the Freseniuses of the world that do the dialysis. They're looking for resources to be able to get their folks help. Because oftentimes one of the things, especially with the feedback we get from like dialysis, is a lot of these folks only have original Medicare because they just became eligible for Medicare as a result of being on dialysis. So they haven't even enrolled in an MA, and many of them, through just not understanding Medicare because, it wasn't on their radar, they might choose a Medicare supplement, and, you're limited on how many will cover you when you're under 65 anyway, or if you meet the medical requirements. But then from there, those costs are going to be very prohibitive for many people. You're going to pay $400 or $500 a month in premium. So being able to enroll in something that's $0 is going to save them a lot of money and put some money back in their pocket through those additional supplemental benefits. This is all the compliance stuff around events and everything. One thing we do, if you want us to be involved with an event, we do ask if you want, Zing's support or just involvement in an event, that you complete our event participation request. This allows us to not only file that appropriately for compliance reasons, but also to make sure that we're not already plugged in a different way. We have a marketing outreach specialist that is out in the market. He was not able to join today, but Don is our marketing outreach specialist, and he's doing an event every day. So we have events that we will plug you into as well, if you are interested in doing events. Marketing materials. So we provide, for all of our contracted agents, you'll get access to what we call, it's a company called TGI, but they give us a platform where we are able to house all of our marketing materials. All of our marketing materials have a customizable version, which means you're allowed to put your information on there. So you can kind of see the examples here. You can put your name, your title, your phone number, web address, email address, and that way, if you leave those somewhere, the only contact information they're going to have for Zing Health is yours. So you're going to be the beneficiary of any work that you do out in the market. These are all provided. You can go in and order these. I will say, if you are contracted and you go in to order these, they come in packs of 25. So if you need 100 of them, do not order 100, order 4, because then you're going to get a call from me wondering if you really need that many. Typically we can tell, what you're looking for, but we do call to verify. But these are all customizable and provided to you. So you can order those and they'll actually ship right to your door. Typically, I like to say it takes about 7 to 10 business days to get. Realistically, you're getting them much quicker. So if you've got events coming up, you're out in the community and want to be able to share this information, you can plug that in and get those ordered. For our network, so here's our list of hospitals. So we have the University of Michigan, Tenet Health, which is your Detroit proper hospital system. You have Ascension, and then you have Beaumont here in Southeast Michigan. So those are the hospitals we're working with. We know there's a couple missing here. We are working on those. Hopefully I'll be able to make some announcements here in the near future, but there are a couple that are approaching the finish line that we will be able to add and just bolster our provider network. One thing our provider team is asking, and working on, is if you have a provider whether it be a specialist or a primary care provider, where if you got them, if they were in network, it would lead to some, being able to get some more folks enrolled, whether you're striking out because their provider's not a network or whatever the other reasons may be. Please share those with us so we can get those plugged in, and our provider team will do outreach. And lastly, before I kind of go to the contact page, and is for our field agents, for every third enrollment, you will earn $600 in marketing credits. So you can utilize that. We have obviously all sorts of stuff you can do. We'll do mail drops. We'll work with you to ultimately decide what you want to do with that. But we also have a program through Medicare Express that is setting preset appointments and things like that. So every third enrollment's going to open up $600 that you can then utilize how you want to market yourself. And with that, I'm done presenting, but I will leave my screen shared here. There's my contact information. If you scan that QR code, it'll allow you to add that right to your phone.
Thank you, Ryan. That was a great presentation. I did not see any questions in the chat. I did come up with a few myself, just some simple ones here. Who is the dental and vision provider with you?
Yeah, we utilize Liberty Dental as the network. Okay. And our vision? Website, if you go to vision is 𝗦𝗏𝗏. If you go to our website, you can find the links to do the provider lookup as well, and you'll see a separate one for vision and hearing and things like that.
Okay. And do you foresee them stretching out the number of counties that they're going to be available in for 2025?
So we can't announce that technically yet, sure. But we are planning to expand into Macomb, Washtenaw, and Livingston County beyond the 3 counties we're in. So kind of rounding out Metro Detroit there. We're waiting on approval from CMS, which should be coming, anytime now, and that'll become a little bit more official. I do have some dates. So first looks will be available July 9th. So you'll see those start to roll out and things like that. So, you'll start to see some things trickle out in the coming weeks. If you're not already contracted, like Sharon said, reach out to her. If you have questions, specific to Zing, reach out to myself or Sharon. But yeah, I would encourage you to start if you're interested in having this in this arrow in your quiver. Start the contracting process so we can get you plugged in and get you you're writing some business, during this rest of your period, and then locked in for AEP.
Sounds great. Well, thank you, Ryan, for this great presentation. And did you say you'll be sending me the PDF of this, or will you be able to?
Yeah, I can send that. Yep, I can send that over to you here shortly.
All right, that sounds great. And thank you, everyone, for joining us today. Like Ryan said, reach out with any questions. And I'll be talking to most of you this week or the beginning of next week. So if it's not this week, have a wonderful Memorial Day weekend. And thank everyone for joining us today. Thank you, Ryan.
Thank you. Thank you, Sharon. Thank you, everybody, for joining.